everybody that had come out a couple weeks ago to my grand opening. It was quite the turnout. I really appreciate you, Sherry. Big winner, thank you. And thank you for the people that came out and helped. Kim was a big winner. There were a lot of big winners actually, because I gave away a lot, and that's a great appreciation that I have for all of my past, present, and future clients. So I appreciate all of you very much. And even the people that couldn't come, I really appreciate Karan, sorry, came out. And so I just really appreciate this group very much. I want to share a little bit about what you may not know that I do, because I always talk about skincare, but there's other things that I also do at the spa. One is I remove skin imperfections. So if you have skin tags, if you have keratoses, if you have skin pigmentation, if you have the little red freckles, the angiomas, or the telangiectasias, anything like that, I can remove those. I have devices that can remove those things. So friends don't let friends grow strange things on their face or anywhere else, right? So I can remove those things, and that's what these cards on your table are about. And I can remove those either using the lamp probe, which uses radio frequency and high frequency, so it feels like heat. Or cryo, it does the pigmentation. I also use cryo to remove warts. So I can do those for you as well, or your family.
I had that treatment done just a couple weeks ago, and it's quite painless. It's a little bit of a sting, but
yeah, but for a few seconds.
Not having a couple of things on my face, I'll take it.
Right, and not leaving scars. Like a dermatologist, they cut things out. I do it pretty much with no scarring. So I love that. Now the two other services that I'm doing introductory offers with any other service is the PEMF, but it's the revised version, the PEMA. So if you go online and you Google or you use ChatGPT, if everybody goes onto ChatGPT or your favorite AI app and you type in what is PEMF, or what can PEMF help with, go ahead and do that. Then it's going to give you a laundry list of things that it can help. The number one thing it does is it improves circulation. You pair that with red light therapy and you've got a winning combination. I can do this underneath of you, this on top of you, and you're gonna get a bam of nitric oxide. So what that means is that you have red blood cells that tend to stick together the older we get, and that means that the microcapillaries get clogged up, and so your microcapillaries don't constrict and dilate as quickly as they do when we're young, and that means less blood flow, which means less oxygen to all of those tissues in your body. Now, of course, I'm interested in skin the most because that's what I am a professional in, but this is all of your tissues and all of your organs and all of your body. So the biggest thing that causes illness in our body is inflammation. Inflammation is the number one thing that causes all kinds of chronic illness across the board. Your cardiovascular illnesses are caused primarily from inflammation. Your insulin dependence or insulin resistance is caused by inflammation. So if you get that blood flow flowing in the way that your body is organized to do or created to do, then you're gonna have less inflammation because that oxygen is getting to all of the organs correctly and it's repairing the mitochondria inside of the molecules inside of the cells so that you are repairing the cells as they are being damaged. We are damaged on a daily basis by all of the toxins that we are exposed to everywhere we go, whether it is the preservatives, the chemicals, the pesticides, the herbicides, all of the things that we put into our body, the cleaning supplies, the fumes and pollution outdoors, you name it, we're exposed to toxins every single day. And I haven't even started to talk about the stress that we endure, right? You turn on the radio or the TV. You know, I personally don't watch the news because stress releases cortisol, and I don't like that. That ages me, and I'm all about aging backwards. So I turn that off. So the PEMF, the difference between PEMF and PEMA. PEMA is molecule activation. So this is the new generation of PEMF. And the cloud, which you have seen me bring in, this is the mini. And so this easily wraps around you, any area that you have to heal in, because the more oxygen we get to a wounded knee, a wounded muscle, a sprain, anything like that, the quicker you're gonna heal. So I love this for injuries or for athletes, anybody that pulls something. You can fold it, you can wrap it around a knee, an ankle, a sprain, whatever, and it's gonna heal quickly. The big one, which you saw me bring in a couple weeks ago, is great to lay on, and this is what I put under you when you get a facial or any other treatment, and I put it on the wrist to give you a deeper level of relaxation. Would you agree, Kim?
It totally works. I fell asleep. It's amazing, and it really, it was funny because I had like a tingling sensation at first, and then I went out, so it was amazing.
Totally, so I say it's like my power down at night, where I can just take my brain, which is going a million miles a minute, to just shutting down. It's like, turning off your computer. Other people call it rebooting, I call it debooting. Just turning off everything so that I can fall asleep, and I get a deeper level of sleep and more REM sleep through the night. Then in the morning, I like to put it on the energize cycle, because then it brings my energy back up from that sleep mode up to let's go mode. And it keeps your level of energy up for 12 hours. So those are the two that I use. But then people that have, let's say they have an emotional state, there's a synchronized mode for people to help their depression, anxiety, PTSD, any kind of mental state that they just need a little bit of help getting past or getting through, whether it's a stage of life or whether it is a chronic thing. Synchronize is a great way to just kind of level that out. And then there is a transform mode. That is for anybody that is insane and really likes the gym. Or that doesn't have bad knees. I love to walk. Unfortunately, my knees are bone on bone. So now I'm like, that doesn't feel real great for me. But I can come home, I can put red lights on it, and I can use the PEMA, and now I feel really good after I do those things. But before I do them, not so great of a feeling. So red light, on the other hand, the light therapy, blue light is antimicrobial and antibacterial. So blue light is what I use for people that have acne, scars, or poor lymphatic flow. So this is really great for anybody, like your teenagers, people that have hormonal acne. They come in, I do an acne facial, and I end with blue light. This is also really good. Blue light is really good for mood disorders as well. And it's also really good for helping you to calm down and go to sleep. So I have the mask at night, and I lay on the cloud, which is what my PEMA is called. So I get the best sleep now that I've had in years. And then the red light and the near infrared. So these are anti-aging and healing. So red light helps with collagen and building up collagen. Both of these actually help with bone density. So if you know people in osteopenia, I'm one of them, thank you, chemo, or osteoporosis, both of these help build up bone density. Both of them help, like I said, healing. That's the near infrared over here. Red light, blue light also helps with infection. So if you have like staph infection, even antibiotic resistant infections like MRSA, this helps. So I had a friend that had a port infection, because y'all know that I do oncology facials for people, and she is in my oncology support group, and she had a port infection that was so bad it was coming out of her body, but she had plans for 4th of July weekend with her family, and she refused to go back to the hospital and let them take it out because she was not gonna give up that time with her family. So I went at 12:30 at night over and dropped it off on her porch, and I said, you're taking this with you, you're doing it 2 days or 2 times a day through the weekend, and then you're coming back home after your weekend and you're going to the hospital and you're getting that removed. And that's what she did, and she said that it took the pain away. It had blue light and near infrared in it, and she said the pain meds that they gave her didn't take away the pain, but these lights were a lifesaver for her, and it took away the pain and helped her get through the weekend, and she had a great time with her family. It's those types of things that I live for in my spa, is to be able to bless people and help them feel the best that they can feel, both inside and out. Does anybody have any questions about either one of these?
Did you use it on, you used Veronica's, didn't you? Is that how you started doing
Yes.
the light therapy?
Yep, exactly. So when I went to Colorado, you all know I went through 18 months of chemotherapy, and it did a number on my body, and one of those things was neuropathy. And I had fibromyalgia before I did chemo, but the neuropathy was so much more intense after chemotherapy that when I was in Colorado, I literally got up one day, threw my legs over the side of the bed, tried to get up out of bed, and I collapsed because I couldn't walk on my feet. It was so painful. And I have like a high pain tolerance. Like, I don't take pain medication. I've had 10 surgeries in the last 3 years, never took a pain med. And so when I got back here, I had called Anne Marie actually, and I said, I can't go to KVA or the Exchange because I can't really walk. And she goes, what do you mean? And I told her, and she goes, okay, I get it. And so she told Veronica, and Veronica brought me over her boots with the red light. I wore them twice a day, every day for 2 weeks. Within 3 days, not only was I walking, but the real bad pain was pretty much gone. And after 2 weeks, literally the neuropathy was like it was before chemo. Tolerable, right? And honestly, now the worst time is after I worship in church and I've been standing on my feet for a while, and then I sit down and I get some neuropathy. I go home, I put on red lights, and I'm fine. It's, yes ma'am.
So I have a question in regards to that, because our skin is different than your skin.
Of course.
How does that work with someone like me, with my pigmentation,
Mhm.
with, the blue light, red light kind of thing? How would that work for someone like me?
So red light, blue light, it does not differentiate. It
Okay.
is not like laser.
Okay.
So this is not a laser, this is a light. So it's going to work the same way in your skin. That's a great question, by the way. It's gonna work the same way in your pigmentation as it does in mine.
Okay.
Now lasers, that's a different story. Like even the land probe, like I was talking about removing things, I would use a lower dose with that because that's heat, and I would not want to, I would under-treat you and rather treat you twice than have something hypopigment. Because with you, you are at a higher risk of hypopigmenting. Same thing like if I did a chemical peel on you, I would do a very low and slow process for your skin because you are more likely to lighten your skin with every peel. And I don't do a lot of cool chemical peels anymore. I do cool peels, right? And cool peels, we do like a 2.5%. You don't feel it. There's no peeling afterwards. There might be a little bit of flaking, but that's it. We keep the epidermis intact.
So another question I have, because like you were mentioning about resistance to medications or
Insulin?
insulin things, and I'm just thinking like my husband has an issue with his foot, and it is, it's like, I guess it's probably, like a foot fungus or whatever, but he's resistant to any topical meds, like the topical, and of course, the internal medicine that you take is just not good at all. It really damages the liver.
Yes.
So I'm wondering if something like that would, because it's skin related, it's external, right?
Absolutely.
Instead of sucking something in your body that's gonna damage your liver, just kind of wonder if that might be something he would probably, because he just went to the foot doctor yesterday.
Okay.
And I'm wondering if that could be, also too, because I've been doing some research, we're like Google MDs around here, right?
Oh, of course.
Right?
Yes.
But I also heard that sometimes it could be a circulation problem that could be causing the issue with the foot.
So I would do blue light with the near infrared pad for him, and do the same thing, treat it twice a day, every day, and do it for 2 weeks, and watch that the fungus go away.
Yeah, I'm gonna have a chat with him about that.
Absolutely.
So those are products that you would buy from you?
You can buy them. I also rent both of these. I only rent the mini because I use the big one every day in the spa and at home.
Okay.
So I rent the mini, but I actually have this mini going out this afternoon. I said I can't give it out until after my presentation today. But yeah, I have plenty of the red lights to rent out, but yes, you can purchase them as well.
So we have a friend who, she has neuropathy in her feet,
Mm-hmm.
but it doesn't manifest as pain. Both of her feet are so numb
No,
Yeah.
that she has a hard time.
walking.
Well, you would never know. I mean, we know her, but she manages it. You would have a hard time knowing that she has that.
Right.
But
That's me too.
there are times you'll see that the numbness is affecting her balance and so on. Will any of these work?
I would say the red light. It combines the red and near infrared in the boots, and that is what, because mine was numbness and the thin, like the needles at the same time. Like, it's hard to explain neuropathy at the worst because they're numb, but it's almost like hitting your funny bone and it never going away. So it was that intense, but at the same time, when you step on it, you have that feeling, but you can't feel the floor underneath of you, if that makes any sense whatsoever.
So if the numbness gets better, is she gonna feel the pain?
So that's an individual basis, but even if she did, eventually, if she's using the boots, I will tell you that the doctors told me there was nothing they could do for my neuropathy. And that's what I got told by the podiatrist, that's what I got told by my oncologist, that's what I got told by my GP, that's what I got told by all the doctors. Until Veronica brought me the lights, I was like, oh my gosh, I have to live with this? This is insane. And they're just saying this is just part of the chemo. I'm like, why would anybody take the chemo for this kind of quality of life? But the lights, to just have to do it twice a day, even if I had to do that the rest of my life, which I didn't, praise God, but even if I had to get that much better of a quality of a life, I totally would.
I want to add, I have the lights myself, and I know Molly does. Two things that I've found myself personally with them, not me personally, but my parents. My mom one day had this wound on her hand, and I'm like, Mom, what in the world? And she had burnt herself a couple days earlier with bacon, really bad, like giant splatter for the bacon, and it was we were going to have to go to the ER or urgent care or something because it was infected, and I went, oh, maybe I'll try that. The next day I went and saw her, you could not even tell the redness was gone. It was already on its way to healing. I could not believe, it was bad. It was really bad. And she was trying to put like salve and stuff on it, which just made it worse.
Right.
And this just literally healed it in a day. It was crazy. And then edema, swelling.
Yes.
My dad gets like swelling in his legs and stuff like that. And that's the reason I bought them actually, was for my mom and dad, cause it was like, I want something to help them, and they work.
Yes, they reduce inflammation, they reduce pain. I have a lot of back pain because of the osteopenia. I have spinal degeneration, all, bulging discs, all kinds of fun, really fun things. And again, I'm one of those people, you can't tell by looking at me and watching me walk down the street. But at night before, if I have really bad back pain, I'll put this underneath before I go to sleep, and I won't wake up from the pain. But there are times when, before incorporating all of these fun things, I was waking up multiple times a night. And, there's sleep, and then there's good sleep, and then there's interrupted sleep, and there's horrible sleep. And so, they say that if you don't get 8 hours or 7 to 9 really good hours of good sleep, that's where your body really starts breaking down. On the other hand, if you get 7 to 9 hours of really great sleep, that's where your body regenerates the best. Your body actually recovers 30% more while you're sleeping, and that's why I love doing the lights right before bed, doing the cloud right before bed, because you're getting that good circulation, that good oxygen, your mind is at rest, and so you can get that really great sleep and good circulation, the oxygen to all the cells where it needs to be.
What's there for arthritis?
So arthritis, you need both, right? You need the oxygen to the cells to get the blood flow in there, but I like the red lights for the inflammation. So for my arthritis, I like the red lights for the inflammation. My knees get really inflamed. However, the mini cloud to wrap it around my knees when they've been really, really swollen, I've done both. So because I didn't have my red lights at a convention, I had the mini cloud, and I didn't need electricity, because the red lights, you have wires, you have cables, you need the electricity. The mini cloud is cordless. You can take this on the airplane. You can take this on car rides. You can sit on this while you're driving. You can wrap this around your knees. This is why they sell these in kits, because you can easily wrap this around your knee. And I will tell you that I wrapped this around my knees at the convention, and I ran it for 2 segments of the, the T1, transform modality, and I could visibly see the swelling reduce. So both of these would help. It's just a matter of, I would love to sit down and do a one-on-one and see what are all of the things that you want to address, and then we could probably figure out which one makes the most sense for you. Thank you, guys. Oh, one other thing, I have the new sunscreen. Finally, Byron has the new sunscreen, so if anybody wants to test it out, it's very luxurious, it's very moisturizing, does not feel cakey or greasy or anything like that. So if y'all want to try that out, you're welcome to come on up at the end.
Jamie gave me a good point, put it on your lips too, and it feels really nice.
Yes.